Good evening, everyone. Thanks for joining us today. My name is Hooman Rampur, and I'm the president and one of the co-founders of CORE at UCLA. We're presenting today as part of the Undergraduate Research Week, and I would like to use this opportunity to let our other co-founders introduce themselves. I would like to start with John, and then we can move to Neel.
Hello, everyone. I am Jonathan. I am a co-founder of CORE, and I'm very excited to be presenting here at the Undergraduate Research Week. I think we have a great presentation lined up for you, and thank you so much for coming out and spending the time to listen to this presentation. And I hope you all learned something useful and enjoy the presentation.
Hi, my name is Neel. I'm the last co-founder of CORE. Yeah, I'm really excited to present this topic for you, and let's get right into it.
All right, thanks, Neel and Jonathan. So in CORE, we do different research projects. We focus on community research projects. And so for today, we chose opioids as our topic. And yeah, so you can see CORE stands for Community Outreach Resource Organization. And then if you want to learn more about CORE, you can go to our website, core@ucla.com, which is the specific website for CORE at UCLA. And then I would like to pass it to John to go over the next slide.
All right, so here at CORE, our mission statement is a little lengthy, so I'm going to get into a little bit. CORE aims to highlight systematic issues that often go unreported in the field of healthcare. This is accomplished through raising awareness in media mediums, such as podcasts and articles, in conjunction with enabling our members to participate in action initiatives related to these issues within local communities and around the nation. The reason why CORE kind of operates under these parameters is because we believe a strong part of having a club that has significant impact in both research and community service and outreach is one that is generally meant to link things for people outside of a comfort area or a comfort zone, which is why we're trying to kind of create a more intimate interaction and focus on issues that impact local communities in the area and also other communities that we can personally reach out and impact. So this is one of the main reasons why our mission statement is so geared towards problems and tying in healthcare or health-related needs for local communities. And then I'm going to pass it to Neel to talk about our goals in particular.
Yeah, so our goal here at CORE, kind of along the same line as our overall mission statement, is to offer our members a holistic understanding of modern medicine and emphasize the importance of intersecting science and social factors. We're doing this by offering a variety of programs that we have partnered with to help deliver a personal and direct experience with local communities starting in South and West Los Angeles. So going off this a bit, I think we understand that these days in medicine, we need to have not only a solid understanding of the science and everything that it comes with that, but also knowing what sort of social factors are affecting our patients and population as a whole. So I think if we can offer our members a bit of insight into that area, I think we've done our job, and that's our goal here at CORE. So we'll move on.
All right, so I'm going to be talking about the current projects at CORE, at least one of the projects I've been working on a lot, and this is for CORE Diabetes. It's another sect of CORE, and one of the main projects for our diabetic populations in our local communities that we've been targeting is a brochure explaining the difference between CGMs and finger sticks, which are two types of glucose monitoring systems to allow people to help keep track of their diabetes. And we are soon to distribute with agencies in the area to type 1 and type 2 diabetic populations, just to give an example. But this work wasn't founded on our want in particular to just randomly choose a specific illness or something that impacts people's lives like diabetes. This was founded on research. We'd like to present some of the research to provide justification for another project that we've been working on, which is CORE Opioid.
Thank you, John. So the project that I'm mostly focused on is CORE Opioids. And so so the opioid overdose is like significantly high in the West Los Angeles area. So we thought that this would be a good project for our members and core as a general to follow. So since a lot of the issues are happening in low income families, and a lot of like the drug consumption is in those areas, we think that like the emphasis on education can decrease the dangers of opioid overdose in these instances, and just like informing the community and just being active about it, and providing basically ways to prevent the overdose, which we will go over in more detail in the future slides, would help the community, and we can basically avoid this overdose that's happening in a significant rate in the West LA area.
So yeah, just a little bit of background information on opioids. Opioids are a class of drugs that interact with receptors on nerve cells in the body and brain. They include pain relievers, as well as a list of street drugs like heroin. When taken, it can make the user feel euphoric and pain-free. And due to their highly addictive nature, many are illegal, but there are also some that are legal and are prescribed by healthcare providers to treat pain. These include oxycodone, hydrocodone, and others, such as Percocet, codeine, morphine. And the use of these prescription drugs for short durations as prescribed by a doctor is generally safe and is often a common way of relieving immense pain. However, misuse of prescription opioids can lead to addiction and even overdose or death. Misuse can include taking a drug that's been prescribed for someone else, taking a prescription medicine differently than described, for example, taking it more frequently at a higher dose. And so these are kind of the areas that we're highlighting in our presentation, and the sort of community health problems that we're addressing is kind of the misuse of these drugs, and which leads to addiction and other negative outcomes. So not to get too bogged down in the biological aspect, just some good background information, just so you're familiar with how opioids work. So they work, so throughout our body, we have opioid receptors that will be kind of a binding site for these drugs when they're taken. And when, as you can see in the figures, when the opioid molecule, you have morphine, for example, binds to these receptors, you're able to activate the body's internal system for regulating pain, reward, and addictive behaviors. So a lot of times, even within our own body, we have opioid substances that are produced naturally, and the system exists there for a variety of functions. But when we introduce these drugs, they often can bind to the same spots, and at a far higher intensity and dosages can lead to these feelings of pleasure and pain relief. So one of the interesting biological aspects of these receptors, which are called the mu opioid receptors, are that they are a G protein coupled receptor, as shown in the diagram on the left. They have the characteristic G alpha beta gamma subunit, which then leads to cyclic AMP, which is a classical second messenger. And this, as you can see, activates a lot of very prominent signaling pathways such as MAP kinase and PI3K AKT. And I think that's an adequate amount to know about this. I think we're not going to focus too much on this, but just knowing that this is within our body already present, and these drugs are taking advantage of this to sometimes do good in terms of the medical sense, but sometimes they also can be abused.
Okay, thanks. Thank you, Neil, for giving us some background info on the opioid receptors in our brain. That was very interesting. So, well, basically, this slide is about why opioids matter, and basically why it's part of like one of our projects. So, as I said, we are heavily focused on the community research. So, one of the things that we found out was like the opioid consumption is very high. Like the opioid consumption is just high in like the West LA area, and then the opioid overdose is also very high. So these are some statistics that I'm going to read to you, and you can see how significant this is. So California had the fourth highest number of drug overdose deaths in the nation, 4,868 in 2017. The age-adjusted state mortality rate of 12.3 deaths per 100,000 people, however, was lower than the US rate overall, 21.6 deaths per 100,000 people. And then, well, the LA County, there were an average of 464 accidental opioid related deaths per year from 2011 to 2017. And, well, I think, yeah, okay, yeah. On average, individuals who died from the drug overdose died 30 years prematurely. So the opioid overdose is like happening at a young age, which makes it like even a bigger social issue. So those are just some statistics, and I would like to pass it to John to give us more details about why this is part of core.
All right, to further exemplify why opioids matter so much and why this is such a why this issue so significantly affects our communities. Again, this has a big burden on our hospital systems and healthcare systems as well. So we have hospitalizations and emergency department visits related to opioid diagnoses have increased 31% and 51% respectively between 2006 and 2017. And obviously, this is just a general trend. These numbers have gone up significantly over the years, especially with COVID. We have some more data regarding COVID and some of these addictive drugs in the future here in the presentation. But there is also a substantial increase in the costs associated with these hospitalizations from opioid diagnoses. So patients who are coming in for opioid overdoses or taking opioids are becoming a bigger and bigger burden on the healthcare system, which has exponential impacts and deeper systemic issues on hospitals to be able to provide for other patients and treat other patients when hospitals are already filling up. For example, just going back to COVID-19, we have seen massive hospital burdens when COVID-19 started really impacting people, and there are a lot of cases, which is one of the main reasons why it was such a big issue. It wasn't necessarily because of the mortality rate, but it was directly from COVID. It was more of a mortality rate related to the hospitals. And this is the same thing that's happening with opioids, in which they are bogging down the hospitals and they're unable to provide treatment to help save other people's lives in some instances. And this is one of the compounding factors. Again, another statistic, according to the National Survey on Drug Use and Health from 2012 to 2014, we had the prevalence rate of misusing and abusing prescription opioids in the past year in LA County was 4.7%, which is higher than the national average of 4.3. So not in particular. So while this is already sort of a big issue nationwide, locally in LA, there is a strong emphasis to focus on this particular area because it is one of the greatest impacted places in which opioids can majorly decimate a given system. And now we are going to go back to Hooman and talk about some different opioids.
Thank you, John. And yeah, so we have some examples of opioids here listed. So one thing is that a lot of these opioids are prescribed by physicians or people who can legally basically prescribe these drugs. And well, a lot of them are also pain medications that are generally administered in hospitals. So it's not like they're completely illegal. A lot of the drugs actually come from legal sources. So here we have oxycodone, then we have hydrocodone, then we have codeine, oxymorphone, and then we have morphine. So a lot of you probably know morphine. It's like if someone has a surgery, then they can use morphine as like a painkiller after the surgery. So that's like a post-surgery drug that is commonly used in hospitals. Then we have fentanyl. That's a very strong opioid. And then we have heroin, also a strong opioid. These are definitely not, well, fentanyl is, but heroin is definitely not used for um, any like medical purposes. And then we have synthetic or street fentanyl. That is probably the strongest opioid that exists. And well, generally the public thinks that that's only the issue, like the street fentanyl or heroin, which are the illegal, but just the prescribed ones also caused issues, at least in West LA, because of the abuse of those drugs and how they were prescribed. But then people weren't able like to dispose them properly, or they give it to like someone else, someone like with someone with the prescription, just like gave it to someone else illegally. So there are a lot of like complex stuff going on with this opioids that needs to be addressed. And yeah, so we can go to the next slide.
I did just want to add something real quick on this slide, is that I think one of the main messages is that there are pain prescription medications that include opioids. There is a larger systemic problem regarding opioid use that is coming in through illegal means and not necessarily legal means. But I guess the point of this slide is to show that there are a lot of legal means to obtain opioids, which can be addictive. And it's not necessarily in the most controlled environments. When you're in a home environment or you're taking it out of patient, we don't necessarily know what the patients might be doing with these. And this is how we can inadvertently lead to addictions, which is also why we need to be careful with the administration of these medications and not having too open of a barrier for administration of these medications, kind of further promoting regulation in that sector as well. So we're also going to be showing a few graphs as to where certain geographical areas relating to opioid related deaths. Here, as you can see, we have a large map, and it is essentially like a heat map of which areas have the most opioid related deaths. So as you go further up, or as you go towards a darker color, that tends to have greater opioid deaths, and gray means that we don't have any data. So as you can see in the San Gabriel area, we don't have too much data here. And again, this is just a map of the larger Los Angeles County and a little bit beyond. It looks like the average is 16.11 based on this graph. Again, quite a few areas where it looks like opioid related deaths is near zero. There are a lot of yellow areas, as you can see here, in between the West and the Metro. In San Bernardino, there are a lot of areas. But if you look at very specific regions, such as south of Antelope Valley, and also a few places in the Metro region or downtown, we do have high opioid related deaths in very specific neighborhoods. So when we do plan on going in, we want to make sure that our focus is going to be targeted towards these specific communities. Obviously, this is good information for a lot of people to have, but in terms of prioritizing the resources that we can provide to communities, we will be trying to look for communities like this based on the geographical incident related deaths, because that way we can prevent more deaths from occurring in these areas, assuming similar trends occur throughout the years. So we are now going to move on to the rate of opioid overdose deaths per 100,000 in the population. So essentially just a relative percent number by opioid type. And these are talking similar to what Hooman was talking about. We do have heroin, prescription opioids, which is the RX opioids, which is what we were talking about. And we also have synthetic, which is more of a street found drug. And it's been on the rise recently. As you can see, starting in 2015, there was a significant rise in synthetic fentanyl or other opioids as of late, and it has almost caught up and is soon going to supersede heroin and opioids. Obviously, this data isn't the most up to date, but just showing the general trends. We do have a large amount of this very significantly powerful synthetic opioid usage on the rise. And that's very concerning in particular now because of how effective it is and why it really makes opioids a more pressing issue to get into as of this moment, because with the synthetic on the rise, it does make this issue a little more significant. We are going to see more hospitalizations and we are going to see more opioid overdose deaths due to this rise of the synthetic opioid with newer technology used for these terrible purposes. So we also have, again, talking about the misuse and abuse of prescription opioids. Again, they are used as pain medications, but the misuse of them by people who handle them, maybe because they don't necessarily know all of the risks associated or the potential addictiveness of these medications. This is a graph just from 2012 to 2014, and we are comparing the US population, California, and Los Angeles County. It does look like, based on these graphs, that from the ages of 18 to 25 years, we do have a significant increase in the misuse and abuse of the opioids for this kind of slightly younger population. And since they are adults, they can technically make their own medical decisions. So we do feel like this is a community that can be significantly targeted. But another thing that is quite disturbing from this data is that if you look at people who are older than 26, numbers are significantly lower. We have 3.4%, 4%, and 4% across the board. So the big problem is that the 12 to 17-year-olds who technically cannot legally give their own medical consent and may not be fully aware of what they are taking, this group is one that we really want to reach out to in a more discreet way in these certain communities, especially in LA County. Technically, it's slightly lower than the US and California, but it is a big problem as a whole, considering 5%. We do have a 5% relative gap of the opioid misuses coming from 12 to 17-year-olds, which is, I reckon, it is a fairly large number, considering the average is mainly being pulled up from 18 to 25-year-olds who can proactively get this medication on their own. So we do believe that educating the younger population in a more discreet way on the dangers of opioids, or also parents to make sure that they're to better watch their children and make sure that this does not become a larger problem, is in effect. And we will be targeting some of our community outreach towards these different avenues.
Yeah, so that's what I was discussing earlier. So it's a lot of adolescents that are and teenagers that are at risk for misusing the opioids. And there are a number of ways, like concrete ways, that parents and family members and other adults can like help prevent this opioid misuse among this population. Well, adolescent brain is still growing, and these people are vulnerable to addiction, but they can also learn healthy habits. So to help prevent like the opioid misuse in this like specific ages, which is like the young people, a lot of the times, like especially in ages of 12 to 17, a pain reliever is like usually prescribed to a young person. And then, well, the person takes that pain reliever or whatever the doctor prescribed, and they just take it, and they become addicted to that pain reliever, and then they go to experience other sort of opioids. So we want like the parents to ask the doctors if it's being prescribed, what are you prescribing to my child, or what is my child taking, it's very important. And then we want them to ask for like alternatives to these opioids, like if we have like a pain reliever opioid, can we use another thing, so that no one like gets sometimes it's unavoidable, obviously, because the opioids are like commonly used pain relievers, and probably like the hospital doesn't have them, but sometimes we can like at least get some information from the doctor what's being injected into my son's body or my daughter's body. And then, so also when you are prescribed a drug, make sure the medications are safely all are safely basically stored at your house, and make sure that you dispose them when they are expired, or they are not you can't use them basically any longer. And make sure that it's in a safe place. That's also very important, especially if a young person is taking it. And then just like talk with your basically with your loved ones, or those who are taking the opioids, um, about like uh, their treatment, or how are they doing, like just like build a strong relationship with them. And then if you are not like the parent, or you're just a friend, or maybe you're like you don't know them well, but if you're suspect that this person is using opioid, just encourage them to talk openly about um, what the treatment they're going through, or if they are addicted to an opioid, it's fine, let them discuss it. Like there should be no issue about discussing these things in the society. It's just um, many organizations are doing great things without like being judgmental about any of this. So, and that's how it should be. It's just some people are taking pain relievers. It's completely okay. Some people are addicted to opioids. That's also okay. I mean, it should be accepted that some people have this issue and they are dealing with it. So it's just that we ask everyone to be more and then open. And then so I would also wanted to add the signs of opioid misuse, which could be helpful for the parents. Um, so one of them is fatigue, obviously, and then slow breathing is very common. Constrictor pupils, flushed skin, dry mouth, itching, and vomiting could be the common signs.
Okay, so now we are going to be talking about age-adjusted rates of drug overdose deaths induced by heroin by race or ethnicity. And another point we want to make is that this does impact many different races and many different communities as a result. Based on the geographical distribution, sometimes it's easy to construe data to specific races based on the percent populations of different races in different neighborhoods. However, we do want to show this chart. Granted, it is a national average, but we do want to show how it is impacting multiple races in relatively high rates. As we can see, white, non-Hispanic, all of these numbers have gone up significantly in the past couple of years through 2017. We have wide, significant increases starting in 2009 to 2010 is when there was a big kind of increase year over year. As you can see, overall, everyone increases. We've had a recent dip in 2017. It has since gone up, as future data will show us. And going back to what Hooman was saying, a lot of these local communities that are impacted by opioids, it does need to be reached at many different levels. We do need to reach a lot of these different specific communities because, as you can see, all of these numbers have increased. We have the Hispanic population, where they're at 3 per 100,000 deaths in their respective population. We have white non-Hispanic people at an astounding over 6 deaths per 100,000, which is certainly very alarming. And then we also have Black non-Hispanic, which is also increasing at a faster rate recently. And that is about 4 to 5 deaths per 100,000 of their respective population. So again, this doesn't need to indicate why we need a widespread and not just specific targeted approaches to specific communities in terms of cultural connections. We do need to provide a wide scope of cultural connections in order to help solve this crisis, because it does impact so many races and so many ethnicities in so many systemic ways.
All right, thank you, John. So here we're going to discuss heroin, one of the illegal opioids. So the dangers of heroin is heroin is very addictive, and there is a high risk of overdose from it, and also death, obviously. And heroin often contains like additives, such as sugar, starch, or powdered milk that can clog blood vessels, leading to lung, liver, kidney, or brain damages. So, and these are like permanent damages. In addition, like to just consuming the drug itself, um, in since this drug is injectable, a lot of the time those syringes that are used to inject the blood are infected with other viruses like HIV and hepatitis in some cases. But HIV is very common, and that's like in many countries, that's how HIV is spread basically. Um, and then yeah, so just so that you know, like heroin is also made from morphine, that is a painkiller. So but it's like a very high dosage of that, so that's why people like easily overdose over heroin. And then it's very addictive, and there are like the 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 results of high consumption of heroin is very similar to other opioids. It's just more severe in many cases, like restlessness, severe muscle and bone pain, sleep problems, diarrhea and vomiting, and other outcomes of heroin consumption. Yeah.
Thank you, Hooman. So, um, as you were saying, heroin, which is derived from morphine, um, is a very popular drug, but morphine as like alone is used in a hospital setting to relieve moderate to severe pain after surgery. Um, it is a highly addictive substance, and this is something that nurses and doctors are obviously well aware of. So when administering it to patients, they try not to keep patients on it for too long, and they understand that over time you can build a tolerance to it, you can build a dependence on it, and you would need a higher and higher dosage as you go on. This sort of uh, increased tolerance and addiction that you develop in the hospital can sometimes result in you seeking it out after your surgery is over and your stay at the hospital is over. You're trying to find morphine. This can lead many people down the path of misusing narcotics. So, despite being probably one of the more tame ones that are on the list here, it is in many ways one of the more common ones that patients have exposure to. And in that way, it's important that we monitor its role in the hospital as well as outside. Um, and yeah, it operates in many of the same ways as the other opioids by changing the way the brain and the nervous system responds to pain. And once again, binding to those opioid receptors and sending out more euphoric and pain relief signals to the body. So something that maybe you guys have heard of on the news and kind of all over the place recently is fentanyl. Fentanyl is an opioid that is 100 times more potent than morphine and 50 times more potent than heroin. I think we included this figure here that kind of really highlights its potency and its danger, really, is that we have heroin, and then we have another two, fentanyl, and we can see those white dots are obviously fentanyl, but there's to equal that much of a dosage of heroin, you only need that few amount of fentanyl. And then there's even the kind of the unanimous strongest opioid on available in the world is kind of used as a tranquilizer. It's called carfentanil, and there you can see I think it's just one speck of it is equivalent to all of that fentanyl and all of that heroin. So it's something that's extremely powerful. It's synthetic, and because it's synthetic, it's oftentimes able to be produced outside of, let's say, a well-regulated setting, such as from prescription companies or from the hospital, and it's often found and sold in street drugs. And so, although there is prescription fentanyl that is used to treat patients with really severe pain, especially after surgery, fentanyl that is illegally manufactured is dangerous, and it's made without quality controls from pharmaceutical grade fentanyl. And it is a major contributor to recent increases in synthetic opioid overdose deaths. This illegally manufactured fentanyl is sold illegally as a powder, and because of this kind of unassuming appearance, it can be added to other street drugs such as cocaine and sometimes in marijuana as well. and this can get really dangerous as people don't expect to be taking something this potent, and it's can result in overdose, an accidental overdose. And because of this, it's kind of been a real issue for law enforcement to crack down on it and try to reduce its prevalence in society and on the streets. Yeah, so going off that, we'll go to the next slide. So like I was talking about earlier, this kind of rise of opioids in general and fentanyl especially kind of had some interesting and alarming consequences during the COVID-19 pandemic. This graph shows that to some extent that as soon as that's the start of the pandemic, which is indicated here as the March 17, 2020, when the state of emergency was declared, we see a noticeable rise in confirmed opioid-related deaths and probable opioid-related deaths after that period, so bulk of 2020 and 2021, where the data was available. Many public health organizations and cities are trying to find out what exactly was responsible for this, like what factors within the COVID-19 pandemic made it such a strong force that made people more susceptible to maybe taking opioids and overdosing. The current consensus is really around that in this period of isolation and of a kind of like the lack of social connection, many people were trying to cope with that pain or the fear of the pandemic and kind of like the change from their normal setting, their normal life, by resorting to these drugs. And with the rise of fentanyl and obviously the high potency of opioids already, opioid abuse can lead to overdose very quickly. And as a result, many people were in their homes and police would find them overdosing. And this was a big problem. And when they looked more into the data, they saw that this was particularly common among males, middle-aged people, older adults, and in the Black and African American community. And yeah, as people who are really interested in like the social effect and how it intersects with medicine, we're trying to see if there are ways, maybe like in the new pandemic world afterward, or whatever you want to call where we are right now, and how social disconnection and permanent changes that have resulted from the pandemic might have effect on citizens in Los Angeles and all over the nation, and how they might have to resort to opioids, and how we can try to help them however we can in trying to foster more social connection and make them feel part of a community to avoid them possibly overdosing. I think we'll move on to the next slide where we talk about safe disposal.
Thank you, Neel. Yeah, so I'm going to be talking about safe disposal. It's another proactive thing that has been shown to significantly improve the tracing and tracking of these opioids. As we were talking about earlier, especially with the prescription medication deaths being a significant factor of deaths. When we have these prescription medications and we're able to safely say that they're at a significant risk or a significant decreased risk of being used by someone else, or when we have essentially an uncontrolled substance outside of the medical field that was distributed from the medical field, if we follow these simple steps, it will significantly reduce the potential for these medications to be picked up and used by other people when it was not authorized for them to use, or not authorized for the patient, the primary patient to use, given that their condition might have changed or improved. For example, one of the main procedures to do this is to mix medications with an unpalatable substance and to place the mixture in a container, throw the container in your household trash, and scratch out all personal information. And again, we feel very strongly about having to tell and sort of propagate this information outwards to many different communities because of the fact that we have so many more cases rising, and we have opioid confirmed and opioid related deaths. If we are able to control these substances better, this can help take down a few of those numbers and potentially bring us back to a little bit more of the pre-pandemic levels, especially with a lot of states coming out of a pandemic state. Is going to be easier to reach communities without the overarching health fear, and it might be easier to help prevent this contamination of these drugs into the larger population.
Yeah, I think along with safe disposal, which is another really good way of kind of negating the negative effects of opioids in the community and within your homes, we have opioid antagonists. So opioid antagonists, maybe if you're not too familiar with kind of like the biological term, it's really just something that can counteract opioids. It can kind of be like an antidote in many ways. So opioid receptor antagonists block one or more of the opioid receptors in the central or peripheral nervous system. And the two most common ones are naloxone, which has its generic name is Narcan, and naltrexone. So I think it helps that we kind of brought up some of the biology of opioids and their mechanism. We have obviously these opioid receptors throughout the body, and opioids bind to them, and they can obviously release signals that are euphoric and pain relief. But when we have these antagonists, they will bind in place of those opioids to these opioid receptors, and they will, by blocking it, they will prevent the drug from really taking effect, and it'll slowly reverse the patient's state back to somewhat of a normal state, kind of like robbing them of their high in many ways. So yeah, so these are specific molecules that will target the G protein coupled receptors, and it's been a really powerful tool to counteract overdoses or kind of opioid patients that are unstable, especially as first responders, EMTs, as police officers. Anytime you're able to find someone and you can administer Narcan is usually one of the best ways of just ensuring that they live, making sure they get the help that they need. The next slide, I can show you a bit more of what I'm talking about with the biological aspect. Here we're showing naloxone or Narcan, and we're reversing an overdose. So we have the brain, obviously, and we have the opioid receptors on the brain, or they can be in the peripheral nervous system. And we have an opioid, which is labeled in orange. It's going to bind to these receptors. But when we introduce our antagonist, or kind of our antidote, which is naloxone in this case, it will bind to these receptors, and the opioid can't. And it's a drug that's available in multiple forms. You can have an intravenous one, which is more of a liquid form, an intramuscular, kind of an injection, or one of the more common ones, I believe, is intranasal, in which you can spray it into your nose, and it's a really fast-acting reversal of the opioid high. It's FDA approved for use in an opioid overdose and the reversal of respiratory depression associated with opioid use. I'm not sure if we've mentioned that earlier, but one of the ways why opioids cause overdose and causes death is that it slows down the respiratory system. And when you take too much, it can almost make the patient unable to breathe, unable to get adequate oxygen to their body. And due to inadequate respiration, they become unresponsive. And without maybe some life-saving action, such as administering Narcan, they might die. So naloxone, naltrexone, they're available in both oral and long-acting injectable formulations. And yeah, I think as these tools are available, and given the prevalence of opioid overdose in the West LA community and Los Angeles as a whole, we have been really interested in finding ways where we can perhaps make people more aware of where to get this, so they can maybe give it to someone who they might suspect might need it at a certain point, or just to have it in case of an emergency in any sort of situation. So I think this takes us to our last slide, or kind of our call to action. I think Hooman will start off with that, and we'll all kind of say a few things before we end.
Thank you, Neil. So yeah, so we learned about opioids, what they are, and how they're affecting our communities. Now we want to see how we can take action and possibly save lives. So one of the ways is so as Neil talked about the opioid antagonists, one of them was naloxone, or also known as Narcan. So there are the LA County. They created a program called the Overdose Education and Naloxone Distribution, which their goal is to reduce the overdose. So they are providing free Narcan to reverse the basically the opioid overdose. And we well I so we found this summary of locations they are doing this, and they are in partnerships with different organizations to hold each of these events. And it's going like it's ongoing. It's they are just doing this. And we so what we plan to do is that we get involved in this, and also make brochures and let the community know more about this location. And yeah, so this is just a great way to fight this issue based on the community research that's being done. And yeah.
I think another point that we kind of want to bring up with this in particular is that some of the points that we're bringing for the biological perspective is meant to sort of inspire and almost encourage an intrinsic motivation to assist in coming up with better research for creating, developing new drugs to help prevent opioid overdoses or have better life-saving methods. Obviously, Narcan was a great chemical to find and discover. Obviously, we can do so much more. So again, this is sort of a call to action for the scientific community to take a little bit of a deeper look into opioids and sort of the biochemical pathways that it impacts. While it has been studied extensively in the past, we believe that this is probably one of the strongest or most vital points to where we do need more medications to help tackle this overarching biological, social, and systemic issue.
Yeah, so just going off that, I mean, we are here in Undergraduate Research Week, so it's obviously important to encourage research. But along with core, we love to talk about science, and we're all interested in research ourselves. But we also want to take a step back and kind of, as we were mentioning throughout the presentation, with the social factors in the pandemic, the social factors in people eventually even going towards opioids as maybe some sort of relief from something that's going on in their lives, the hardships that they're facing. I think one of the most important things we can do is to find ways where we can better our community. We can try to make people feel like they have a place here. Because oftentimes when we have people who feel that they're part of something, that they don't need to resort to sort of things like opioids, which can maybe lead to some dangerous things down the road. It's about feeling wanted, which is obviously a natural human emotion. And so we have this program with the city of Los Angeles that we're definitely going to be working with in core. We're going to talk more about the biology, and we're also going to see what we can do in terms of being that light in the community and trying to make it a better place for everyone. Yeah, I mean, that's my piece. If anyone else wants to join in.
I think you wrapped it up pretty well.
All right. Thank you for being today with us and spending this time with us. I would like to also thank our members who contributed to this presentation. And also I would like to thank Neil and John for being part of this. Hope you have a great rest of your day. Make sure you take care of yourself. Thank you.